Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling series and chairman of the AACP in the UK. I just want to spend a few moments talking to you about the concept of using the needle as a diagnostic tool. Now, that might seem strange. You've already done your assessment, your diagnosis, you do a treatment, you're deciding, well, maybe I'll do some acupuncture, maybe do some dry needling, and you put that needle in and you get your stimulus and away you go. But I'll ask you to step back a moment and think about that needle as an extension of your fingers. And in some cases, when we're dealing with very deep, tight structures, let's say we're dealing with issues with multifidus perhaps, and when it's underlying longissimus, and we want to assess what's going on in the lower back or the relationship between the lumbar spine and the sacrum, palpation sometimes can be a very blunt tool for telling us what's going on, and we can get much more information sometimes from the needle. And inserting the needle through various tissues as we move through different layers, we can ascertain what's happening from a myofascial dysfunction perspective in those layers. What we can also do is when we explore through that tissue and we palpate with the needle, not only can we decide where perhaps there's a dysfunction and where there's a problem, but whilst we're there, we can treat that as well. So assessment and diagnosis becomes treatment and therapy. So that's just a short note on thinking about the needle as a diagnostic tool. Think about it as an extension of your fingers. I'll talk to you again later about feel with the needle, but for now just consider that. So when you're palpating, if you're palpating the lower back and you're trying to identify which structures might be at fault, perhaps think about next time you put a needle in, put that needle in nice and gently, direct it deep into the tissue and move through those layers and think about that anatomy and think about that tissue that you're going through and what you're feeling. Take your time, don't rush it, and use it as a tool for palpation and see what you can get as far as treatment and outcomes. Just entertain that idea, and I'll speak to you again soon. All the best for your clinical reason and your clinical practice.